many of you know someone with diabetes? Raise your hand. Wow, everybody. I was in the emergency department one busy afternoon, and I picked up a chart that said ear pain, 6-year-old female. Very common sort of complaint, and I thought this would be a quick one, so I grabbed it just to get out of the way. But when I walked in the room, as I was entering the room, the nurse was leaving, and I said, I want a blood sugar. And she said, a blood sugar on the 6-year-old? I said, absolutely. Because I was convinced that this was not just a regular ear infection. You see, with diabetics, a simple infection can become life-threatening. And I was convinced just on entering the room that this little girl already had diabetes. They checked her sugar, and her sugar was 13. Now, to give you an idea, if your sugar is above 11.11 on any sugar, meaning a random sugar, it doesn't have to be fasting, you have diabetes until you can prove it otherwise. Why did I believe that this 6-year-old girl had diabetes? Because she weighed 90 kilos. And that is my introduction to where diabetes is going. Most of us are used to the old terms of classifying diabetes. Like, for example, you've got what type of diabetes in the young? You've got the juvenile diabetes. So we say juvenile diabetes, and then the older is the adult what? Adult onset diabetes. We don't use that anymore. And that is because of the phenomena that we are seeing. You can't say juvenile diabetes anymore, because what type of diabetes did this 6-year-old girl have? Yes, she had 2. Who said that? That's correct. She had type 2 diabetes at age 6. And it was due to the fact that she was massively obese. You see, type 1 diabetes and type 2 diabetes are 2 different mechanisms in the body. There are 2 different causes. In type 1 diabetes, which is more common or less common than type 2? Much less common. In fact, estimates guess at about 95%. 90 to 95% of all diabetes is type 2, or what we used to call adult onset diabetes. The type 1 is relatively rare. They believe that that is caused by an autoimmune phenomenon. And I just want to give you some insight here. When your physicians say, well, this is autoimmune or idiopathic, or we use all these funny words, it means we don't know. It means we don't know, or we're not sure, or there's not a clear cause of why the body is going haywire. Now, theoretically, in this case, it is autoimmune because the body itself begins to attack the beta cells in the islets of Langerhans in the pancreas. You don't need to remember all that. Just remember that the body itself is attacking the insulin-producing cells in type 1 diabetes. Now, there is some theories, some preliminary research that shows that those beta cells can share what we call crossover or cross-reactivity with casein. Now, what's casein? It's milk protein. So some people are theorizing that the early exposure to cow's milk sets up the reaction for type 1 diabetes. Now, that is not 100% proven, but that is what some studies are leaning towards. But of course, we're not going to talk about the other forms of diabetes. There's many forms of diabetes. There's bronze diabetes, there's diabetes insipidus, there's all kinds of diabetes. But the 3 major forms of diabetes are type 2 is the largest, and then type 1, And there is also a diabetes that occurs in about 2 to 5% of pregnant women. What diabetes is that? Gestational diabetes. Now, is that a big deal? That's actually kind of a joke, really, because what is the problem with having diabetes when you're pregnant? Big what? Babies. Yes. Now, consider for a moment what the treatment for gestational diabetes is. Does anyone know? Well, traditionally, that's not what they've done. They should do diet, of course. What medicine do they use? Insulin, yes. They use insulin. Now, remember, when you give the mother insulin, who also sees the insulin? I want you to think about that for a while because that's going to become very, very important later on in our lecture. Because I have seen babies up to 10 kilos from many of these diabetic mothers. Many of these babies are so large, they have to be delivered by C-section. They just won't fit. They won't come out. And that is because insulin is a, what kind of hormone? Growth hormone. It is probably one of the most powerful growth hormones in the human body. In fact, there are certain types of cancers that produce a growth hormone. They call it insulin-like growth hormone. Have you heard that? Or insulin-like growth factor. So insulin is an anabolic hormone. It is a growth hormone. It produces an abnormal amount of growth and weight gain. To give you an idea, this is from your literature. This is absolutely fresh. This is an estimate for 2015. They are estimating 1 in 4 Canadians lives with diabetes. And in 2020, it will be 1 in 3. Which province has the highest incidence of diabetes? It's actually Newfoundland. But Saskatchewan is very, very high. It's Newfoundland, which is 9.3%. Saskatchewan was 8.5%, and Manitoba was 7.5%. Now, that is actually a confusing statistic because they're using statistics of all Canadians over age 1. And most young people don't have diabetes. Does that make sense? So the ones in brackets are a little bit more accurate. The ones in brackets are the percent of adults over age 20. So when you look at Manitoba, Saskatchewan, it's close to 25% of the adult population. That's pretty high, don't you think? That's crazy. In Newfoundland, amazingly enough, what would you suppose their incidence of obesity is? They're number 1, actually. 71% of their adults are either overweight or obese. There is a direct correlation between obesity and the incidence of diabetes. Incidentally, Quebec has the lowest incidence of adults that are overweight and obese. But did you know what the lowest percent is? 51%. That's the lowest percent. That means the majority of Canadians are either overweight or obese. Is that concerning? Absolutely it is. The CDC, which I spoke to some of you yesterday, I think some of you were wanting to know about the whole vaccine issue. And I normally, I dismiss most of those things, but there were some incidents in the CDC where one of their physicians came forward as a whistleblower. But anyway, that's another presentation. But the CDC has now estimated, this is in my country, it's just as bad. Anyone here born in the year 2000 or afterwards? Anyone young in the room? Yes, a few people. Every child born after the year 2000, if they are Caucasian, 1 in 3 will die of complications of diabetes. If they are Hispanic or African American, 1 in 2. Do you think this is going to be serious? Absolutely. Now, typically, What do people feel when they are diabetic? Well, that's typically the type 1 diabetes. Yes, they feel thirsty. The type 2 diabetics can also feel thirsty. Does anyone know why they feel thirsty? Well, the body is trying to compensate, right? The body is trying to get rid of the high levels of glucose. And how do you think it gets rid of it? Urine. That's right. One of the most common organs of elimination is the kidneys. But in order to eliminate the sugar, what does it pull with it? Water. That's right. So they become very, very, very dehydrated. And I'm thankful that there's some water up here. Well, not really, but that's fine. They become very dehydrated. What other symptoms do diabetics have? Weight loss, that's true, because even though their sugar levels are very high, it is not getting into the cells. Did you know that? The cells are starving. The glucose is backing up in the bloodstream. What other symptoms might they have? Tired, sure. They're not getting enough fuel. Anything else? They can get yeast infections or other infections because diabetes suppresses the immune system. Any other symptoms? You know what the most common symptom is? Nothing. Did you know that many people have 0 symptoms with diabetes? In fact, your first symptom might be that your kidneys are gone. Your first symptom might be a heart attack. Your first symptom might be irreversible damage of some kind to your body. Diabetes is very, very insidious. It often does not have symptoms, or the symptoms are very, very slow. Now, I put up here signs. Signs are things that you can see on somebody, or you can examine them. What might you see on somebody as I examine them? Yes, you could have gangrene or nerve loss in the fingers and toes. Anything else? Blindness, sure. It affects your retina, absolutely. Anything else? The what? Yes, they might be dehydrated. Their skin might show signs of dehydration. People sometimes get pigmented, darkly pigmented areas in their axilla. Have you seen that in some people who are diabetic? Also, people can have trouble with their vision. Some people will say, I know when my sugar's off right away because what? My sugars create like the blurry vision. On the lab tests, the most common thing we find is, of course, the blood sugar. If you have a fasting blood sugar of greater than 7, that is considered the cutoff for diabetes. But of course, you might find other things too. You might find sugar in the urine, right? You could find an abnormal, does anyone know what a hemoglobin A1C is? That is a very interesting lab test because a lot of people, when they go to see their doctor, they will be very strict about their diet, and they'll like go 10 kilometers a day for the week before their appointment, and then they'll come in and they'll check their sugar and they'll say, see, it's normal. But you know how I can tell? The hemoglobin A1C does not lie. Because the hemoglobin molecule is a part of your blood. And when you have high levels of blood sugar, the sugar sticks to everything around it. Think about that. It's like sticky candy or juice, right? The high levels of blood sugar will stick to different molecules, and one particular molecule it sticks to is the hemoglobin molecule. Now, your red blood cell lives how long? It's about 90 days. 90 days, 120 days, it depends. But the hemoglobin molecule can have little bits of sugar stuck to it. We call it a glycosylated hemoglobin. And that's what the hemoglobin A1C measures. It measures the total hemoglobin molecules as the denominator and the glycosylated ones as the numerator. And that gives me an estimate of what your blood sugar has been for the last 90 days. So you can't cheat when you go to your doctor. There's also a glucose tolerance test, right? They have you drink something really sickly sweet, and then they measure your blood sugar an hour later, 2 hours, 3 hours, whatever they want to do later. You know, it's very interesting now. Have you noticed that when you get your blood work, the blood sugar is always flagged as high now? Have you ever noticed that? That the cutoff has now really dropped on the blood sugar? In fact, I know that all of my lab tests in the United States, they will flag a sugar as high at 5.5 now. Do you know why they're doing that? Anyone know? Well, yes, because what they are finding is that people are pre-diabetic and that they can experience the damages of diabetes at lower blood sugars. They are finding that people who have a blood sugar even of like 90 or like 5, that if those people have a consistently blood sugar of like 5 or 5.2 or 5.25, then they carry one gene for diabetes. If you are consistently at 5.25 and 5.5, then you carry both genes for diabetes. So the actual threshold is coming down all the time. And the danger is that people don't know. In fact, in almost half of our states in the US, we found that there was kidney damage already that went undiagnosed in 90% of the patients in one study in 2013. And so these individuals had already experienced damage, but they didn't have any symptoms. And that is the scary thing of diabetes. The number one cause of death, who remembers in diabetics? Heart attack, that's right. Your risk of heart attack is 10 times higher if you have diabetes. And death is not the only problem, because it's not about just quantity of life, it's about quality of life. Diabetes is the number one cause of 3 different things. Can anyone name one of them? Who said blindness? Yes. Blindness from what? Yes, that's exactly right. Wow, I'm amazed that you even knew the mechanism of that. The diabetics get diabetic retinopathy, and what that causes is an abnormal proliferation of blood vessels. And those little blood vessels are very stringy. They're very fragile. And so they tend to bleed easily. And when you have bleeding, you get a scar, right? A clot. And the problem is that scar, right? You can't see through it. That's the issue. And that's why people with diabetes go blind. They also have a higher incidence of cataracts as well, but you are correct. It's diabetic retinopathy. Some people say that macular degeneration, I heard that, is actually the number one cause of blindness. There's debate on that, but I'll give it to diabetes. So diabetes is also the number one cause of 2 other things. Yes, renal failure. Wow, you're really the information buff of diabetes here in the front row. The good students are up here, right? So kidney failure or dialysis is a big problem with diabetes. Some people actually estimate that it's really hypertension that actually causes more dialysis and renal failure. But I'll give you that, diabetes as the cause of kidney failure. And lastly, anything else? Yes, you could talk about circulation or vasculopathies or amputations, but actually peripheral vascular disease is the number one cause of that, but diabetes is a risk factor of it. They get gangrene, right? They get toes cut off. We do the below the knee amputation, above the knee amputations. So yeah, that's true. Well, I'll give you a hint. When I was in medical school, there was a blood pressure medication that really didn't work very well. And so the drug company decided to cut their losses and say, listen, we're going to recall all the drugs, get all the drugs back from the study participants. We're not going to continue the studies anymore. But to their surprise, the people who were in the clinical trials didn't want to give back the medications. And they said, why? It doesn't really work. And they actually reported a very beneficial side effect to the blood pressure medication. So they took the medication out of the cardiology department and put it in a different department. And I noticed that all of my colleagues who were either residents, interns, or staff in the urology department, they were selling their houses, they were taking out loans, they were selling their cars, they were borrowing all the money they could. And I said, you guys are crazy. They said, we are not crazy, just watch. And they took all their money and they put everything into Pfizer. And they made 700% on their investment in 1 month. And the drug was Viagra. It was initially a blood pressure medication, and it didn't actually work so well. But it ended up being quite possibly the highest selling aphrodisiac that has come onto the drug market. So diabetes is actually the #1 cause of erectile dysfunction. Although that doesn't cause death, that certainly decreases quality of life, right? Some people think, well, I don't have diabetes. Is this lecture really relevant to me? Well, it actually is, because you can be a transient diabetic. Now, what does that mean? That means if you were to eat something that is especially high in fat or sugar, but mostly fat, that your blood sugar level will rise and then it will fall because your insulin is normal, your cell's response to insulin is normal, but it's not instantaneous. Have you ever noticed you eat ice cream or a big banana split and you get like a cold a few days later? Have you noticed that? Or you get a runny nose or a cough or a sore throat? It runs you down because when the blood sugar is high, the white blood cells cannot fight efficiently. Normally, a white blood cell can defeat 12 different invaders like bacteria or viruses, things like that. But when you get someone who is an uncontrolled diabetic, meaning a sugar of, let's say, like 15, 17 or higher, that same white blood cell can only kill one invader before it dies. It really dramatically reduces your immune system. So even though you may not be diabetic per se, you may be raising your blood sugar levels inappropriately high by the foods that you're eating. Now, let's say someone is perfect in controlling their diabetes. If they're perfect, they take their insulin, they take their medications, they follow the Canadian Diabetic Association diet, did you know they still lose 10 years off their life? Just having diabetes by itself means minus 10 years. So that means all the bonus we get as Adventists goes out the window if we're diabetic. So don't do that, right? What is the cause of diabetes? Now, this is a trick question, so be careful. What's the cause of diabetes? Yes, most people say sugar. But interestingly enough, and this is a very interesting. This is a very, very old study from the University of Kentucky. This is a landmark kind of baseline study. Is Dr. James Anderson wanted to prove that sugar, eating too much sugar, was diabetics. You know, people say, you know what? You better not drink too much fruit juice, you'll get diabetes, right? You've heard people say that, right? Oh, don't eat that banana, you're going to get diabetes. Have you heard people say that? Oh, don't give me fruit, that's the worst thing for me. I'm diabetic. Have you heard people say that? I'll show you. Dr. James Anderson of the University of Kentucky took healthy volunteers and he gave them ½ kilo of white sugar every day. They had to actually eat it. I think he put it into water or solution or something like that to make it a little bit tolerable, but ½ kilo, that's a lot. And he followed them for months and months and months. There was absolutely no diabetes. Then he did what's called a crossover design with a washout period. So in other words, when you do a crossover design, the same people are their own controls. Does that make sense? So in other words, the first time they were on the high refined sugar. The second time, he raised the fat in their diet to 60%. Now, to give you an idea, a rich diet is typically about 42%, 45%. So he raised it to even a super rich diet. He raised the amount of fat to 60%, and within 2 weeks, 100% of the study subjects showed lab evidence of diabetes. In other words, he could produce sugar in the urine, he could produce an abnormal glucose tolerance test, or he could produce an abnormal hemoglobin A1C within just 2 weeks. So what is the real cause of diabetes? Fat. Now I'll show you how this works. If you were to imagine for a moment a cell, what happens when the body consumes too many calories? What does it do to those calories? It turns to what? To fat, exactly. The storage molecule for us, for mammals, is fat, right? So when the cells become too full of fat, they begin to remove the insulin receptors from the cell surface. In other words, they say kind of no vacancy, if that makes sense. There's no more room. And so what ends up happening is that it becomes more and more difficult to stuff more blood sugar into that cell because it's full of fat. Does that make sense? And so what happens if the glucose can't get into the cell? Where does it back up? In the bloodstream, exactly right. So the high blood sugar is not the cause, it is the result. Does that make sense? So if you eat too much fat, particularly animal fats, and what are animal fats? Meat, dairy, right? Ice cream, milk, whatever, stuff like that. Those are animal fats. If you eat too much animal fat, you will fill up those cells and put yourself at risk for diabetes, right? Very, very important. And remember, not all fats are created equal. We'll talk about some of the benefits of fat on Friday. But that is the issue. It is really fat. Now, obviously, if you eat too much sugar, what does the body turn it into? Fat, right? So ultimately, yes, that is a problem. You don't want to eat too much refined sugar. But even simple sugars can be good for you. In fact, the people who say to me, don't give me fruit, I'm diabetic, you'll kill me. You know what I do with those people? I challenge them. I said, for 3 days, I'm going to put you on just fruit. Pure apples. Do you guys grow apples here? Apples, blueberries, different berries. So I like apples because apples are high fiber and they're high water content. So they fill you up. Does that make sense? So I put them on pure apples. They said, well, what do I drink? Water. I give them just water and apples for 3 days. They said, you're going to kill me. That's pure sugar. I'm going to die. I said, I promise you, you will not die. In fact, you can call your doctor 3 times a day. You can take your sugar 10 times a day if you want to. You can watch and see what happens. What do you think happens at the end of 3 days? Their blood and blood pressure. Who said blood pressure? That's also true. That's also true. Their blood sugar is actually better. Some of them are actually able to reduce their medication by the end of 3 days. And then they say, okay, I'm listening. Tell me more. Doubt. But hey, it works, so I'd like to know more. Well, no. Type 1 is a little bit different. We can talk about type 1 afterwards. You can cure type 1, but you have to get them in the honeymoon phase. Only about 10% of type 1 diabetics can be completely reversed. And when I say completely reversed, that means no dependence on insulin, no dependence on any medication. Does that make sense? But 95% of type 2 diabetics can be completely reversed. That means no shots, no pills, none of that stuff. Just pure lifestyle. But how do we typically treat diabetes? What's the most common treatment for diabetes? Insulin, absolutely. We give people insulin. Now, Watch what this does. When you give somebody the diagnosis of diabetes, right? You send them to the dietitian so they can learn about a special diet. You teach them how to inject themselves. You teach them about what to look for, how to cut your toenails or how not to cut your toenails. You have a professional cut it, right? How to check your feet, how to check your eyes, right? You do all this education for the diabetics. And after you're done doing all this education, let's say you put them on a low dose of insulin. And you say, come back and see me in a month. And in 1 month, they have gained 3 kilos. And you said, what are you doing? Didn't I teach you about diet? And they said, I'm sorry. I'm just smelling food and I'm putting on weight. I don't know what it is. And then you have to raise their insulin and you say, listen, come back in another month and you have got to really be serious about this. Otherwise, I'm not going to be your doctor. And they say, okay, doctor, I'll do it. And you raise their insulin level, and then they come back in 2 months, and now they've put on 4 kilos. And they say, I don't know what it is, doctor. I swear I'm not eating anything now. I promise you. Now, what could be happening? Does anyone remember the first part of our lecture about the big babies? What type of hormone is insulin? Oh, no. What type? A growth hormone. We are putting our patients on a growth hormone. Is it any wonder that it's hard for them to lose weight? Now, I'm not saying that insulin is evil. Like when I see people, they come in a diabetic coma. I've seen blood sugars of 50 or higher. And those people, I put on fluids, and I don't just give them insulin, I give them an insulin drip. Did you know that? Insulin in the vein. But is insulin the cure? Have you ever heard someone say, yes, my doctor, he raised my medication level, and now I don't have diabetes anymore? That seems kind of weird, doesn't it? In fact, that never happens. In fact, insulin affects the body in other ways. Insulin accelerates atherosclerosis, or the accumulation of cholesterol plaque in the arteries. It would be like me saying, you know what, I'm nearsighted, and so, hey, I'm no longer nearsighted. Is that true? No. What does this change? Just the symptom. Does that make sense? But it hasn't changed the shape of my eyeball. Do you understand that? This is only curing the symptom. But it has not changed anything in my actual body. And so the same thing is true with diabetes. The insulin is managing the diabetes. It is taking care of the symptoms of diabetes. And I'm not saying that that's evil. There's a time to manage the symptoms. But instead of taking a hormone, right, the insulin, the increased insulin level will saturate the last remaining insulin receptors on the cell and will stuff more glucose in the cell because you have higher levels of insulin. Does that make sense? Because type 2 diabetics, people say, well, they don't have enough insulin. They actually have higher levels of insulin. Did you know that? A type 2 diabetic, especially early on, they'll have higher levels of insulin because the body is trying to do what? Compensate, yes. There's not enough glucose getting into the cells, so the pancreas tries harder, right, to produce more insulin. But what is the real cure? If the cell is stuffed full of fat, what should you burn? The fat, right? That's the cause. It's fat in the diet and fat on you. That's the cause of diabetes. So the answer to that is burn the fat. Yes, of course, absolutely. Now, there's not just insulin for diabetes. There's pills, right? Does anyone know what sulfonylureas are? There's things called glipizide, glyburide. Have you heard those? Those are the American names. I don't know what the Canadian names are, sorry. But this is a standard treatment for patients taking oral medications. You know what's funny about them, though? Is that they can be a risk for low blood sugar. Did you know that? Because the sulfonylureas actually stimulate the pancreas to pour out more insulin. So if you take this drug and you don't eat, right, you could have a risk of low blood sugar. And which is a bigger risk, high blood sugar or low blood sugar? Much bigger risk for low blood sugar. In fact, I got a call just 2 months ago on the airplane. Will any health professional immediately ring their call light? And you know, people don't ring their call lights anymore nowadays. You know why they don't? Yes, they don't want to be sued. They're not being paid, right? But did you know that Good Samaritan doesn't cover you? Isn't that nice, right? So I had this call, and the other guy that showed up, he immediately looked me in the eyes and he said, just so you know, I am an orthopedic surgeon and I have not taken even a blood pressure since medical school. This is you. And I said, oh, I'm ER. He's like, oh, good, I'm going back. I said, no, don't leave. You're going to help me out. This lady, they had called me because she was having a seizure and vomiting in her chair. I immediately put her on her side, cleared her airway so she wasn't going to aspirate the vomit. And I said, you've got to look for some medications. You've got to look through her bags and find me something. And I found an AccuCheck, a glucometer. And I said, it's got to be low blood sugar. The very interesting thing is I prayed that God would help me with this woman. And the first blood sugar I got was 8. Strange, isn't it? And I said, wow, that's high. That can't be it. And so she's sitting here seizing. I have them hold her down, and I pray, and I said, Lord, help me to get this IV in this woman, because traditionally I'm not putting in the IV. And she has no veins at all. But you know what? I prayed, and I got it on the first try. I got the IV. I spiked the bag, which usually my nurses are doing. I spiked the bag, started an IV, and I checked the blood sugar again. This time it was less than 0.5. I knew it. I knew it. Because I thought, what's going on? And I think the enemy just sent me a false reading to begin to kind of throw me off guard, to get me away from it. I gave that woman 2 full ampules of D50, 2 full glasses of orange juice, and a spoonful of strawberry jam. And after all that, her sugar was just 13. But it dropped in 20 minutes, just 20 minutes, to about 8. It was really going down fast. And so the lady, within 5 minutes, was talking to me. Within 10 minutes, she was walking normally. And when the paramedics showed up to take her to the hospital, she's like, I'm not going to the hospital. And I said, please go to the hospital. Because I hadn't fixed anything. Does that make sense? I had just saved her life to keep her from seizing. You know, because if you seize for like 2 hours, because I told them ground the plane. They said, we're over the ocean. We can't ground the plane anywhere. The nearest place is Hong Kong. I said, go to Hong Kong. But it was 2 hours away. She would have seized for 2 hours and been probably a vegetable or a mineral by that point. And so she didn't want to go to the doctor because she's like, I feel fine. She's like, my blood sugar's been low countless times. I said, but when was the last seizure you had from low blood sugar? She's like, well, she didn't want to go. I reasoned with her for an hour. She still didn't want to go. And finally I told her, ma'am, I hate to do this, but I turned to the flight attendant and the ticket agent, and I said, as a physician, I do not recommend this patient board the next flight without being formally evaluated. And they said, she will not board. And she's like, you can't do that. I said, I just did. I said, it's because I care. She's like, well, I want to go on my flight. I said, you can after you've been checked out. She's like, well, I don't want to go checked out. I said, ma'am, that is your choice. I said, you are welcome to stay in the airport and wait, or you can stay in the emergency department, get evaluated, and then fly. She was very angry with me. But did you know I feel total peace with my conscience? Some people say, wow, you shouldn't have even helped that lady. Really? right? You know, I would have even preferred being sued by the lady later and lose in court than to face the real judge. And he would have told me, he said, Tim, you knew the other guy was ortho and you let my daughter die. Why? Why did you do that when I gave you the skills to save her life? And what would I say? I would have nothing to say. And from that judge, there is no appeal because he knows the hearts of all men. So there is a risk from low blood sugar. In fact, the sulfonylureas all have what's called a black box warning. Does anyone know what a black box warning is? It means a risk of death, right? Do you know what the black box warning says on all sulfonylureas, no matter if they're the newest one or the oldest one? It says sulfonylureas have been shown to significantly increase the risk of fatal heart attack. Now, someone remind me what the number one cause of death in diabetics is. And we're using a medication that has a black box warning that says heart attack. I'm not saying that it's wrong to use medications, but it's not the answer. Does that make sense? And in fact, it may sometimes even exacerbate our efforts to treat our patients. But the most common oral agent is metformin. Have you heard of metformin? Glucophage, right? That's the most common oral agent, and here's how it works. Metformin decreases the insulin resistance in your body. And so it allows the cells to let the insulin come in and let the glucose come in. However, metformin does have some risks as well. Metformin can give you a risk of liver failure. Did you know that? And that is why your doctor has to check your liver enzymes, the AST, ALT, ALK-Phos, the SGT, PSGOT. Have you seen those numbers? Those are the old terms, but it's really AST, ALT, and ALK-Phos now. So they have to actually check those before they start metformin and after, right? To make sure it's not hurting your liver. There is also a very rare complication from metformin, but it does happen, and it's called lactic acidosis. And that's why they always say be very careful if you get like muscle soreness with certain medications. Also cholesterol medications can do the same thing. So there is some risk to metformin. But instead of using the drugs, don't you think there's a better way? If the cells are full of fat, then don't eat fat, right? And then on top of that, what's even better? Exercise. That's right. I am now going to show you the oldest controlled trial known to mankind. Does anyone know what university it was done at? No, it was done at the University of Babylon. Yes, it was done at the University of Babylon. The experimental group, Daniel, Hananiah, Mishael, and Azariah, or as you might know them, Shadrach, Meshach, and Abednego. Those were the experimental group. The control group was everybody else. That's right. That's a good way of putting it. Everybody else. Because the king, in a favor to these Judean captives, right, said, I will give you the best my kingdom has to offer. But is the best always the best? Right? The rich Canadian lifestyle, right, may not be what's best for you. And instead of this, what does Daniel ask for? He says, give me pulse, Melzar. In Daniel 1:12, he says, prove us for how long? 10 days. That's not too long, is it? 10 days? Do you think you could see changes in your health in 10 days? Yes, 10 days. He says, give us pulse. And what is pulse? It is a plant-based diet. Give us pulse and what to drink? Water. Isn't that interesting? So for 10 days, he just takes pulse and water. Isn't that amazing? And the results in 10 days, what was it? They were healthier than all the children that ate the portion of the king's food, and they also drank the wine, by the way. The other guys were drinking the wine, whereas Daniel and his friends were drinking what? Water. Now, I want to share with you that the results of this lifestyle were not just 10 days. Did you know there was another follow-up? In 3 years, they found that in matters of wisdom and understanding, the king, or Nebuchadnezzar, found them 10 times better than everybody else. Do you think a healthy lifestyle clears your mind? Do you think it enables you to be more intelligent and to make better decisions? Now, here's my question. Where did Daniel get this idea of going vegan? What part of the Bible? Well, he actually only had the Pentateuch. Did you know that? He technically only had the first 5 books of the Bible. Did you know that? And he got the idea from actually the book of Genesis. Does anyone know what Genesis 1:29 tells us? It gives man's original diet. Did you know that? And what was man's original diet? Grains, nuts, fruits, beans, right? And what was added after sin? Who knows? Vegetables, actually, not meat. Not meat. Meat wasn't added until there was nothing else on the face of the earth, right? Everything was what? Destroyed. See, people don't understand why God permitted meat. Why do you think they had to eat meat? Everything else was gone, right? That was the whole point of sending out the raven and the dove. What were they going to bring back? Vegetation, right? That things had started to grow. Does that make sense? So if God says you can only be vegan, but everything is destroyed on the face of the earth, you're going to die, right? Does that make sense? So God, in his mercy, permits meat, but that's after the flood. But after sin, vegetables were permitted. But here's the argument about meat. Couldn't Daniel have said, hey, I'll take the kosher meats? Could he not? Let's be honest. Could he not have said that? I'll go lacto-ovo for 10 days. Could he not have said that? You laugh. This is true. Could he not have said that? But he didn't, did he? He did not say that. Even though he could have, right? What religion was Daniel? He was a good Jewish boy, right? Could he not have selected the clean meats? Yeah, he could have said, yeah, I'll have, some beef and chicken and fish, and I'll have some, A&W root beer and some milk. I mean, couldn't he? I mean, really, could he not? But he didn't. Why? I think that is deep. Why does Daniel, when he could have gone kosher, when he could have gone lacto-ovo, why does he go all the way to vegan? Well, come on, you don't want to be legalistic, Daniel, right? I mean, come on. Don't be like extreme, right? And I'm not saying that in certain situations someone couldn't eat animal products, right? For example, if someone was in the dead of winter in Scandinavia, Ellen White actually got a letter from a missionary, and he says, listen, I'm getting weak and whatever. And she said, you need to eat fish. Yeah, she actually said that. But now we can get stuff from anywhere, right? If you say, I want, strawberries in the dead of winter, can you get them? Sure you can, if you want. You can get whatever you want, anytime you want. Transport is just amazing. Just amazing. So Daniel could have been kosher. He could have been lacto-ovo. He could have drunk a lot of things. My question is, why did he go vegan and why did he drink water? Here's the thing. When you look at people who want to serve God, Do they ask, hey, what's the minimum? What's the minimum that I can be saved? No one's going to be saved that way. I'm going to tell you that, right? Well, people say, well, Martin Luther wasn't vegetarian, right? But he drank alcohol too, right? He smoked and he drank and whatever because he didn't know. Does that make sense? He didn't know. Daniel, he knew, right? He knew that he had a short amount of time to prove his point to Melzar and, of course, to the king. And so he selected not just better, but ideal, right? He selected ideal, and he selected water, right? The ideal, the original beverage given to man. And I'm not saying that fruit juice is evil or whatever, but Daniel decided to go all the way. And my proposal to you is to think about that. I'm going to make an appeal for each of you to just try it. I'm not saying you got to go vegan. I'm just saying try it for 10 days. Are you going to die? No, you won't die. If you try Daniel's diet for 10 days, I promise you, you will see changes. Just make sure to talk to someone who has done it so you get a balanced and correct diet. You learn how to cook, things like that. Jesus, when he talked to the man at the pool of Bethesda, he looked at him, and did you know what Jesus' first question to him was? He says, do you want to get well? Doesn't that seem like a funny question for Jesus to ask? It's like the guy's like, no, I'm just like here for my health, right? I've been sitting here for years, right? Of course I want to get well. But did you know that's a question that all of us have to answer? We have to say, do I really want to get well? The question is, does your desire for health exceed your desire for other things, right? When your desire for cure becomes strong enough for change, then you can say, Lord, I believe, help thou mine unbelief. You can say, Lord, I do want to get well, but I don't have strength in myself. I need your grace. I need your strength. One of my grandmother's caregivers was a diabetic, and he checked his blood sugar, and after he checked his blood sugar, he went to inject what? His insulin. Very interestingly enough, I shocked him. I said, Tony, I said, don't take your insulin. He's like, what? You're a doctor and you're telling me don't take my insulin? I said, not permanently, just wait. He said, wait and do what? I said, listen, I will feed grandma. I'll take care of lunch. You go and you take a brisk walk, and here's a liter of water. I want you to drink that down in the hour. And then come back and recheck your sugar. His initial sugar was about 11, 12, 13, 14, somewhere around there. When he came back, what do you suppose it was? Yes, it was almost normal. He did not have to cover his sliding scale with insulin at that point. And within 5 months, my chef Tony was off of all his medications. No pills, no injections, no nothing. His doctor said, whatever you are doing, keep doing it. Because every time I see you, your weight has come down and your insulin requirements go down. I don't know what you're doing, but keep doing it. And the other thing is that he was cooking food for my grandmother, and he was cooking vegan, right? So he would just have some of what he made for us. So he's getting good, healthy food, and I was giving him like a break pretty much every day where he can go out and walk and drink his water. He even got so motivated, he put grandma in her wheelchair, and then he pushed her in her wheelchair on his walk. So he got additional exercise. But that is my recommendation to you. In fact, Daniel's diet has been looked at in comparison to the American Diabetic Association diet. Does anyone know who Neil Barnard is? He is the president of the Physicians Committee on Responsible Medicine. He did a study which looked at the regular American Diabetic Association diet, which is similar to yours in Canada, and he looked at the vegan diet. There were 50 patients in each group, and they were on this lifestyle for 22 weeks. The interesting thing is they did not provide them any food, which I think is important, because if you just provide people their meals, when they go home, then what do? They go back to their old ways, right? So they had to learn how to cook healthfully. In 22 weeks, 43% in which group? Which group do you think dropped their meds the best? The vegan group. Even better than the gold standard American Diabetic Association diet. They reduced their medications versus a quarter of them in the ADA group. The vegan group lost 6.3 kilos. The ADA group lost 2.7 kilos. Here is the biggest one. The LDL cholesterol dropped 21% in the vegan group. Do you know what that means? That means they dropped their risk of heart attack by 63% in 22 weeks. That's incredible. There was better glycemic or sugar control in the vegan group. And the neat thing about the vegan group is there was no limit on carbs, calories, or even portion sizes. They just said, here's how to cook vegan, go to it. In the American Diabetic Association diet, they said, here's a portion size. You can only eat this many calories. You have to limit your carbs. Now, interestingly, the vegan group actually increased their carbs from their baseline diet, but they were eating healthy carbohydrates, right? They were not eating sugary things. They were not eating white flours. They were eating whole grains. They were eating fruits and vegetables. I would like to close with an appeal. Does anyone know what church we are living in? Who are we? We are Laodicea. What is Laodicea's problem? Let's look at Revelation chapter 3, right? Revelation chapter 3. Thou sayest that I am what? Rich and increased with goods and have need of nothing. But actually, Laodicea is what? Blind. Laodicea is too full. Do you see the diabetes? What's the problem in the cell with the diabetic? It's too full. It's accumulated too much. Does that make sense? And we as Laodiceans, we have hoarded God's blessings to ourselves. We are too full. We have not shared. Does that make sense? And the answer to the diabetic is the answer for us, for Laodicea. What is the answer for a diabetic? Exercise. Start to give away that fat for metabolism. Does that make sense? Us as a church, we cannot accumulate all these goods. In the natural world, if you eat and don't exercise, you will be unhealthy. In the spiritual world, if you come to church and Sabbath school but don't witness, you will be unhealthy. Does that make sense? If you simply receive blessings from God without giving them away, you are dead. Does anyone know why the Dead Sea is actually dead? The Dead Sea is dead. Did you know that? It has such a high saline content that very few things can live in it. But do you know why it's actually dead? It receives but does not give. So my appeal to you is that you will share. And I'm going to give you a little song to do it. I'm going to have everyone stand up. This is a song that I learned when I was in missions class. And this is a song that I would like you to sing every day, okay? I'll sing it through once, and then you guys can join me. It's called Lord, Lay Some Soul. Lord, lay some soul upon my heart, and love that soul through me, and may I humbly that soul to thee. Sing it with me. Lord, lay some soul upon my heart, and love that soul through me, and may I humbly do my part to win that soul to thee. How many of you would like to commit to do your part to win one soul to Christ this year? Just one. Just one soul. Raise your hand. I'm going to commit myself. I'm going to commit myself. Let's kneel in prayer as we talk to God. Loving Father in heaven, you have given us so much as a people, but we have become rich and increased with goods. We have become too full, Lord, and just world. So it is in the spiritual world. If we receive from you without giving to others, we are dead, Lord. Help us not to be like the Dead Sea that only receives but does not give. Help us, Lord, to share the knowledge that we have. Help us to share the blessings you've given us as a people to a world that is dying. And Lord, as we saved first is our own. In Jesus' name, amen.